The skin is the largest organ of the body. Its function is to protect the body from invading organisms, protect vital organs, prevent fluid loss, and act as a barometer signaling the brain to dilate or constrict vessels. The skin is made up of 3 layers. The top layer is the epidermis. It's made up of mostly dead cells. The second layer is the dermis. It consists of blood vessels, nerves, and glands. The third layer is called the subcutaneous layer. This is the fatty layer, under which lie muscle and bones. Burns are injuries that damage the skin, vessels, nerves, glands, muscles, and bones. Burns can change the whole physiology of the body and cause life-threatening conditions. Let's take a look at what happens when we get a serious burn. First, the affected cells die from the heat, and that trauma affects the cells around the burn area. The body systems begin to respond. Capillaries begin to leak and fluid builds up. Arteries dilate and blood is sent to the affected area. Due to the breakdown of circulation, fluid builds up in the tissues, causing swelling. As swelling increases and more fluids are lost, respiratory and cardiac function are compromised and the patient goes into hypovolemic shock. As you can see, immediate intervention is required. A burn can cause many systemic problems, which we will discuss during this tape. But for now, remember that for every burn you see, there can be another problem which may not be so easily recognizable. We'll discuss those later. Burns are classified according to depth, severity, and location. Other determining factors include any pre-existing conditions and the age of the patient. The depth of a burn indicates the affected layers of skin. The severity takes into consideration the source of the burn, its location on the body, and its potential to do other damage. For example, an electrical burn may do minimal damage to the skin, but has the potential to do serious cardiac damage. The location of a burn is always a primary concern. Burns around the face and neck can cause swelling that results in respiratory problems. Burns to the upper body are usually more serious than those to the lower body. Burns to the hands, face, feet, or genitals require immediate treatment. To help us evaluate the seriousness of burns, we use the rule of 9s. In adults, the body is divided into sections. Each section has a value of 9% of the body surface. The arms have a value of 4.5% each, anterior and posterior, for a total of 9%. The genitalia has a value of 1%. Since children and infants have larger heads and smaller bodies than adults, their percentage values are a little different. For the most part, we still use the rule of 9s. The head comprises 18% of a child's body surface. The chest and back also make up 18%. The child's arms are 9% of the total body surface. That's 4.5% each, anterior and posterior. The genitalia is 1%. Besides the head of a child being twice that of an adult, the only difference is in the legs. Adults have 18% of their total body surface in their legs, 9% anterior and 9% posterior. Children only have 14% in each leg, or 7% anterior and 7% posterior. Infants, like children, have larger heads and smaller bodies. Their head, chest, and abdomen are assigned 18 percentage points each. Each upper extremity is 9%, and each lower extremity equals 14% of the total body surface, with the genital area getting 1%. The rule of palms is used to determine the percentage of body surface covered by small burns. It is very easy to remember. Each burn, the size of the patient's palm, is about 1% of their body surface. This determination can be used for odd-shaped burns. This burn covers approximately 2% of the total body surface. The age of the patient is also important. Children under 5 and adults over 55 have thinner skin and heal differently than the rest of the population. You should also consider any existing medical conditions, such as bronchitis, heart disease, or diabetes. The assessment of a trauma patient is a 5-step process. The first step is scene size-up. You will consider the mechanism of injury and determine if the scene is safe for you to render assistance.
Hold on a second, let me have a live wire there. Okay, it's secured, it's unplugged, let's go.
Assess the patient's mental status and determine the need for C-spine precautions. Determine if there are any life threats and treat them immediately. Note the patient's skin color, temperature, and condition. Identify priority patients and make a transport decision. The focused history and physical exam or rapid trauma assessment is a 60 to 90 second head-to-toe exam. Reconsider the mechanism of injury and need for ALS. Continue to monitor the patient's level of consciousness. When doing your rapid trauma assessment, remember the acronym DCAP BTLS. It stands for deformities, contusions, abrasions, punctures or penetrations, burns, tenderness, lacerations, swelling. You will also obtain your sample history as time allows. SAMPLE stands for signs and symptoms, allergies, medications, past pertinent history, last oral intake of food or water, events leading up to the injury. The detailed physical exam is done en route to a medical facility. It consists of taking baseline vitals, doing a detailed head-to-toe exam using the acronym DCAP BTLS, reassess all intervention measures, and monitor skin temperature and color, and the patient's level of consciousness. Note any changes. The ongoing assessment is done every 5 minutes for unstable patients and every 15 minutes for stable patients. It is a reassessment of all intervention measures. A superficial burn involves only the top layer of the skin, the epidermis. A simple sunburn is a good example of a superficial burn. It is painful and the skin is red. You will probably not be called to treat a minor sunburn, but if you are, cool the affected area with water for about a minute. Scalding, on the other hand, can be a major burn. It is one of the major causes of injuries to children. Do not mistake scalding as a superficial burn just because the skin is red. Scalding is a very serious injury, especially in children. You will treat a scald depending on the severity and location of the burn. Always consider child abuse when a child is scalded. A partial thickness burn affects both the epidermis and dermis. These burns usually involve blistering and severe pain because of the nerves that are involved. The skin may be red or white and may be moist or mottled.
What are you doing? What happened?
Our initial assessment of this 20-year-old female indicates there are burns on her hand and leg. Her radiator overheated, causing hot water and steam burns. She has distal pulses, so we are going to treat these severe burns immediately to avoid further contamination.
Okay, this is just going to sit on here.
We're going to treat for shock by continuing high-flow oxygen. Protocols differ, but there are 2 accepted ways to treat partial thickness burns. We will show both procedures. Know your local protocols for the treatment of all burns. The first way is to remove the jewelry from the hands and arms. Then apply a dry, sterile dressing to these burns. We'll wrap the hand, leaving the fingertips visible so we can monitor capillary refill. Then place dry, sterile gauze between each digit.
Okay, what I'm going to do is just wind this in around your fingers, okay?
Good capillary refill.
At the suggestion of some medical directors and ER doctors, the second way is to cool the burn for about a minute. Then apply a dry, sterile dressing to these burns.
Use your arm over there.
Good capillary refill.
Never apply ice to a burn as it causes vasoconstriction and may cause hypothermia. Preserve body heat as necessary.
Okay, I'm just going to check you out here real quick, okay? Any pain in your head?
No.
No? You still got your tongue? Okay. Your ears look all right. You don't have any pain anywhere else?
Regardless of
No.
No? Okay, no injuries on that.
no injuries on
Okay,
this side.
back's all right?
Yeah.
Okay, chest is all right? How about in from the side? Okay, gonna press on your stomach a little bit. No pain? Hips? He's all right? No pain anywhere, right? Can you wiggle your toes? There you go. Okay, while you're finishing it up, I'll do that. Okay.
Alrighty.
We'll get our baseline vitals and the rest of our sample history en route. A full thickness burn extends through all the dermal layers and may involve subcutaneous layers, muscles, bones, or organs. The skin looks dry and leathery and may appear white, dark brown, or charred. There may be severe pain or no pain at all, considering the amount of nerve damage. A full thickness burn always scars and disfigures.
What happened?
I went to light my barbecue and caught fire.
Our initial assessment of this 25-year-old male shows that he has partial thickness burns on his face and arms. The left hand is completely compromised by a full thickness burn. We need to remove the jewelry if possible. Some of his shirt is burned into the skin, so we'll cut away what we can and leave the rest. We'll also administer high-flow oxygen. We'll monitor the airway and be prepared to intervene if the airway begins to close due to swollen tissues. You should note that this patient keeps telling us he cannot feel his hand. This is due to severe nerve damage.
You hurt anywhere else?
Just my face really hurts. I can't feel
Face?
my fingers.
Okay, that's real normal.
Cover the burned area with a dry, sterile dressing or a burn dressing.
Neck doesn't hurt? Back's all right?
My back's okay.
Okay, you take any medication for anything?
No.
No? Okay. Allergic to any medications that you know of?
No.
Have any medical history we need to be aware of?
No.
I'm going to go over the worst of it this way. Then we need to go around those fingers with some of the sterile 4x4s. Good.
We will continue to monitor lung
Take a deep
sounds
breath.
as we do our rapid
Let it
trauma
out.
assessment.
Again. Again. One more time here.
We'll get baseline vitals and complete our sample history en route. Circumferential burns are burns that encircle part of the body. They are dangerous because they slow or stop circulation distal to the burn. This is especially dangerous in the chest or abdominal area or around a joint. Smoke inhalation is one of those problems we spoke about that may be overlooked while we are dealing with burns. Whenever you have a fire or chemical burn, you must be prepared for victims suffering from smoke inhalation. If inhaled, heat, chemicals, or smoke can cause lung damage, respiratory distress, or in the worst case, respiratory failure. The mucous membranes and linings of the upper airway scorch and begin to swell, blocking the airway. The signs and symptoms may be as simple as irritated eyes or as serious as respiratory failure. Our initial assessment of this 10-year-old female shows that she was trapped in a burning building. She's coughing and having difficulty breathing. Her skin is wet and pale, and she is cyanotic. At this point, we're going to call for ALS. Her breath smells of smoke,
Can you hear me?
indicating her lungs may be compromised. Remember,
Yeah?
the carbon monoxide in smoke binds to hemoglobin,
happened?
preventing
breathing
oxygen
in all
from
that
being
smoke?
exchanged in the cells. We're going to listen to lung sounds and administer oxygen. We will switch to humidified oxygen once we get her inside the ambulance. We are prepared to assist with ventilations as necessary. We are concerned about potential respiratory problems, so we will start our sample history and do our rapid trauma assessment looking for deformities, contusions,
Okay, I'm just gonna do a quick
abrasions,
head to toe to make sure there's no
punctures or penetrations, burns, tenderness, lacerations, or swelling, especially of the mucous membrane in the upper airway.
Or upper. A little bit of wheezing in her throat.
Let me know if any of this hurts you, okay? Can you wiggle your toes? No injuries on that arm?
No.
Squeeze my fingers as hard as you can. Squeeze. Squeeze. Both hands as hard as you can. There you go. Do you hurt anywhere? Have you ever been sick before? Do you take any medications? What do you take medications for? Allergies?
Right there.
Do you take them all the time? What are you allergic to? Is it medicines?
Ready to roll her?
We will reassess lung sounds and monitor the patient's level of consciousness as we prepare for transport. We will complete our sample history and get another set of vitals en route.
Still doing all right?
Chemical burns are those which not only damage the skin, but can be absorbed in the system and cause damage to internal organs, especially the kidneys and liver. Take the necessary safety precautions at the scene. Our initial assessment of this 40-year-old male shows that a battery blew up in his face. He had chemical burns to both eyes and to his face.
You hurt anywhere else, sir?
No.
Okay, just relax. Just lay your head back. I just put a dressing under there to catch some of the water. We're gonna go ahead and irrigate your eyes, okay?
Okay.
Do you take any medications?
No.
Do you have any allergies to medications?
No.
Have any medical conditions we need to be aware of?
No.
Okay?
Why is it
Contact?
burning? No, I don't.
No contact?
Since both eyes are compromised, we're going to irrigate the burned area with saline. by attaching a nasal cannula to a saline IV. We have established that the patient is not wearing contacts. If he was wearing contacts,
Flush your eyes.
those should be removed before irrigating the eyes.
Try to keep them as open as you
The
can.
prongs of the cannula are placed over the bridge of the nose and the saline fluid forced into both eyes at once. You may have to assist the patient in keeping the eyes opened. If you are irrigating one eye only, be sure the injured eye is lower than the uninjured eye, so the chemical does not splash into the uninjured eye. Irrigate the burned area for at least 20 minutes with large quantities of water or saline as shown.
Your eyes, okay?
Irreversible damage to the cornea may occur if not treated immediately. After proper irrigation, cover the burn and transport.
Okay, sir, we're gonna cover your eyes now. Just go ahead and keep them closed, okay?
Okay.
You wanna sit them up? Think you can sit up for us, sir?
Sure.
When you cover both eyes of the patient with moistened pads, stay with him and continue to reassure him. If your patient begins to complain of burning after your initial treatment, remove the pads and irrigate for another 5 minutes. Continue irrigation en route as necessary.
Okay, we got a little bit of tape.
If the chemical is something dry like lye or dry lime, be sure to brush it off before diluting it. Some chemicals become corrosive when mixed with water. Electrical burns are caused by electricity passing through the body. It usually takes the path of least resistance along arteries and veins, damaging tissue, muscles, and nerves. The severity of the burn depends on the type of strength of the current and the length of contact with the skin. We're talking about amps and volts. To help distinguish their significance, think of volts as the diameter of the hose and amps as the force of the water moving through it. More than 1,000 volts is considered high voltage. Less than 1,000 volts is considered low voltage. The higher the voltage, the more severe the injury. The damage done by amps depends on their intensity. 1 to 2 milliamps can cause everything from tingling and pain to muscle contraction. 30 to 100 milliamps can cause respiratory problems or ventricular fibrillation. 2 to 5 amps can cause severe burns, and 5 to 10 amps can cause asystole. As you can tell, any information you can give the ER staff about the amps and volts is helpful. Injuries caused by electricity include burns, fractures caused by muscle spasms, bleeding, tissue swelling, and cardiac dysrhythmias. Remember, our hearts run on electrical impulses. Surveying the scene, we see that the electrical cord is still connected to the outlet, so we will disconnect that before assisting our victim.
Okay, it's secured.
Okay. Can you hear me? Can you hear me? Wake up. Okay, she's unconscious. She's breathing. Check the pulse.
Our initial assessment of this 10-year-old female shows that she is unconscious with burns on both hands. She's breathing adequately and has a strong pulse, so we will observe C-spine protocols and administer humidified oxygen. One of the problems with administering humidified oxygen from a portable tank is it cannot be laid on its side. Caution is indicated. We are classifying our patient as priority and decide to transport and treat her burn injuries en route.
On the neck.
We'll apply a C-collar and begin our rapid trauma assessment, looking for deformities,
Nothing in
contusions,
the head, nothing in the ear.
abrasions, punctures or penetrations,
Well, obviously,
other burns,
mask on the collar.
tenderness, lacerations, or swelling. If we find any deformities indicating fracture, we will splint them. We will assess lung sounds and continue to monitor pulses. We are prepared to defibrillate if necessary.
Nothing that I can feel in the back.
We get our sample history from the bystander who called 911. Since our patient is unconscious, we elect to treat her burns en route. There are other types of burns, such as radiation and hazardous materials, that we will not discuss. These subjects are best left to the experts. Know your local protocols concerning all types of burns.